Welcome everyone to IsisParenting's Breastfeeding webinar and chat. My name is Nancy Holtzman. I'm a mom and baby nurse educator, board certified lactation consultant, board certified in pediatrics, and I'm here in Needham, Massachusetts, outside Boston at the home office of IsisParenting. Usually we meet at 12 noon, but today I had to push it to 1:30 Eastern Time, so I'm so glad to see people coming into the room. And as always, these are recorded, and then the recordings are posted online at the same webpage that brought you here today. You'll see a long list of all of the recorded topics. With me today is Katie Goldsberry, who is a friend and colleague, and Katie is a programming associate here at ISIS, has been here with me at ISIS for a long time, maybe, I don't know, 4 years maybe. And Katie is the mom of two children, and of two young children. I'm the mom of two older children, young adults. And today we are going to talk about biting. And biting is a really challenging topic because when biting happens, it can be devastating. It can be continuous, meaning that babies tend to go through phases of biting, and so almost every single feeding can feel like a minefield, very scary for the mom, a lot of tension, and sometimes biting can actually precipitate or lead to a nursing strike, which is a very, very distressing situation for moms and babies. I did use this photo on Facebook for this webinar today, but please, I feel so bad for this child. You know, a beautiful, adorable little kid has no idea his parents are making him a laughingstock. So parents, don't do this to your baby, please. And the other thing I want to mention is that, of course, breastfeeding and teeth are completely compatible. And here in the United States, I think it's fairly commonly understood that breastfeeding is recommended through the first full year, and then probably people don't actually know that it's recommended far beyond that as well, as long as desired by both the mother and the child. I think most people think of breastfeeding as being recommended through infancy, but I think we certainly see a big drop-off in terms of breastfeeding numbers by 6 months, and between 6 to 12 months, certainly we see fewer moms breastfeeding, unfortunately. And a common comment that people will hear is, oh, well, you're not going to breastfeed when your baby has teeth. And, culturally, we don't see toddlers breastfeeding so much in the United States, except maybe on the cover of Time magazine. But physiologically, and certainly over time and in other locations, it's very common for toddlers to nurse. And perhaps anthropologically, the appropriate weaning age is probably somewhere around 3 or 4 years old. And does not mean to say that all of you will continue and breastfeed 3 or 4 years. You may not. Whatever, either way is fine. But there's nothing weird or wrong about breastfeeding a child with teeth, and teeth do not need to interfere with breastfeeding, but sometimes they can, and we'll talk about that. What we're talking about today is the older baby who is biting during breastfeeding, and also even unintentionally, the issues that are caused by the top teeth coming in, which can cause some irritation and discomfort to the mom, even when the baby isn't biting, and we're going to talk about that too. And these are different conversations than the brand newborn or the 2 and 4 and 6 week old baby who may be clamping down on the nipple. That's a different situation. That's a different webinar. I cover that in a variety of different webinars, but I put this slide up from the Sore Nipples Part 1 webinar, the thrilling 3-part trilogy of sore nipples. And most of infant newborn clamping down has to do with the latch, whether it's the baby's oral anatomy. Sometimes it's, here, I'll explain what these pictures are. The fresh tube of lipstick here is because this is the classic description of what the nipple looks like when it comes out of the baby's mouth. If a baby is latched shallowly or clamping down, you'll see the head of the nipple being misshapen and slanted like a fresh tube of lipstick. The waterfall is to represent the fact that sometimes babies will clamp down on the nipple when there's a lot of milk coming very, very fast. And so a heavy milk flow, overactive letdown can sometimes lead to a baby clamping. What is this lizard doing hanging on by his teeth to a string or a cord? If a baby's body doesn't feel supported, if the baby is not being held in a way that they feel they can relax and latch on, and very commonly they will clamp down with their gums to get it to feel like they have a better grip. And so you always want to make sure that the baby's torso, hips, and legs are supported when they're nursing, that they don't feel like they're dangling and need to grasp tightly. And then this street sign here is representing what we call a compression stripe. And so if a baby is clamping or latched shallowly at the nipple, sometimes you will actually see a white stripe across the face of the nipple. It depends in what position. So it wouldn't be necessarily a horizontal stripe. It could be at an angle. But when you see a stripe across a nipple face, that's usually a tell for a lactation consultant that the baby's clamping down. So I refer you to the Sore Nipples webinar to get more info on some of these things. Okay, but now we're going to talk about teeth and teething and biting and how to prevent, perhaps, and how to cope or manage. So first, I'll mention quickly teeth versus teething. And those of you that listen to me, have taken classes with me, or follow me on Twitter have probably heard me say before that that teething is different than a tooth about to erupt. So teething is a developmental behavior. A lot of times people will say that their 3 or 4 month old must be teething because the hands are in the mouth, the baby is chewing, there's drool everywhere, the baby is starting to get frustrated and fussy and wakes up more at night. So bingo, it must be teething, right? You can call that teething if you like. That's a normal developmental behavior. I would put money on the fact that it will still be several months before a tooth actually erupts. So the hands in the mouth, the chewing, the drooling, and waking up more at night is classic 4 to 5 month old behavior. The average first tooth erupts generally around 6 to 7 months. You can see in this chart here, typically the first 2 teeth that come in are the 2 bottom teeth, followed by the 2 top teeth, and then the ones next to those, which are called the lateral incisors, and then the ones next to those, which are the canines. The molars don't actually come in until the baby is 1.5 and 2.5 years old to finish getting the molars. So teething is a long, slow process when you're talking about teeth actually filling in. Does not have to do with the drool, with the chewing, and so on. Biting is a phase, and it often occurs around 7, 8, 9, 10 months, usually up to a year. Biting as a behavior, like biting a friend's arm when fighting over a toy, or biting out of frustration, is a separate issue. I'm talking in their mouth like a nipple and bites down on it. And that actually can become a very challenging behavior when it's perpetuated like a game, when the baby gets a glint in his eye and clamps down. So a good prevention method is important, and I would say that starting around 5 to 6 months, no longer give your baby your finger to chew on. So sticking your finger in your baby's mouth before they have teeth and letting them gum on your finger is certainly a very normal thing to do, and we know that newborns and infants like to suck on your finger, and then when they get older they like to chew and put pressure on their gums using your finger. But even before they have teeth, a baby can't really differentiate or understand why is it okay for them to bite down on your finger but not okay for them to bite down on your nipple, which, let's face it, actually feels very much the same inside their mouth. And so my suggestion is around that 5 to 6 month mark, stop putting your fingers in your baby's mouth, and don't let them get the idea that biting other people's flesh is okay. So that also goes for your nose, your chin, your shoulder. Treat biting as as a behavior that you want to nip in the bud, and you're not allowed to bite other people, period. You just don't bite other people. You can bite yourself. You can chew your fingers. This beautiful baby is Bianca's little boy, eating his toes. You can eat your hands. You can eat your own feet. With or without teeth, if you want to bite down, go right ahead. See how that feels. But you can't bite anybody else. You can bite your chew toys. And this beautiful little girl is chewing Sophie Giraffe, which is an excellent chew toy, an excellent teether for young babies. It's lightweight. It's got lots of areas that fit very nicely in a baby's mouth, and you can really get a good chew going. If you're not familiar with Sophie the Giraffe, it's a moderately expensive chew toy of safe rubber sent from France. And of course, when you put French writing on the toy, apparently it can cost 25% more. But I will tell you that it is a glorified dog toy, and babies simply love it. They love it, and it works well, and I recommend it. So if you click the baby who's chewing Sophie the Giraffe, it will take you to the ISIS webpage, and you can learn more about that toy. Okay, let's talk about what happens when your baby does begin to get teeth. The bottom teeth are actually not so much of a problem, because when the baby is nursing and latched on, those bottom teeth are covered by the tongue. So it could be toward the end of a feeding when they're playing around, they may bite you with those bottom teeth. But when they are latched on in nursing, you shouldn't feel those bottom teeth at all. It's covered by the baby's tongue. The top teeth, however, those do begin to feel irritating when they first cut through. Now, especially the front teeth are pointed teeth, and when they come through the gums, they are razor sharp. And so, it's kind of like those top teeth resting on the top of your breast tissue. It's kind of like a sharp fingernail, just gently scritching you back and forth and back and forth and back and forth for 10 or 15 or 20 or 30 minutes, 5 or 6 or 7 or 8 times a day. So it can cause a little irritation or an annoying sensation. It usually doesn't cause a cut or a sore or anything like that, just having them be there. You do want to help those teeth dull down a little bit, so give your baby firm chews, firm teethers and things to gnaw on, like the wooden squish toy or something like that. And those teeth do dull down a little bit. I'm not advising that you use an emery board on them, but sometimes dentists actually do that when they're fixing a tooth, or if if a sports player or somebody like that breaks a tooth a little bit or chips a tooth, they do use emery board to kind of gently dull the sharp exposed point. The other thing I'll mention about that is that babies do it themselves by grinding their teeth, which is such a freaky and irritating thing to listen to. I remember my kids used to do it in the car. And when they get those top teeth, when they've got the bottom teeth, which usually come first, and then the top teeth come, I think the baby must kind of wonder, what is all this stuff going on in my mouth, and what's the sensation and sound that keeps happening when I chomp them together? Because it does seem like after the top teeth come through, the baby spends about a week gnashing their teeth and biting the top teeth onto the bottom teeth and making that tooth grinding sound, which will send shivers up your spine, but does serve to help dull the sharpening down a little bit. And if they do bite down, the top and bottom teeth together are trouble, because if they are biting down on the nipple and they've got top teeth and bottom teeth, you are in trouble. And that's why we're going to talk about how to prevent that and how to avoid that. So babies do tend to go in nippy phases, and a phase may come and you deal with it, and then it resolves, and then a week or 2 or 3 or 4 later, you kind of are going through it again. And usually it does have to do with a teething phase. So they're about to cut a tooth, and their gums are very irritated, and they're in a biting phase. But what you want to do really is nip it in the bud and not encourage these behaviors, and be proactive and watchful. So very commonly, these happen at the end of a feeding when the baby's hanging out playing around, or if the baby isn't particularly hungry. And remember that a baby cannot bite and nurse at the same time. It's one or the other. So if they were nursing, their tongue is extended, and if they bit down, they'd bite their own tongue. So if they are biting, they are not eating, and therefore you could end the feeding. Toward the end of a feeding, when you suspect that your baby is wrapping up, maybe they usually nurse for 10 or 15 minutes. So, by 9 or 10 minutes, when your baby is slowing down, playing with their foot while they're nursing and so on, maybe it's time for you to end the feeding before your baby decides to just kind of hang out and take a chomp. In this position, you want to keep an eye on your baby. Maybe you typically watch TV while you're nursing, or read a book or something like that. But if your baby's in a nippy phase, stay attentive, watch your baby's behavior, and cross-cradle position, which is many parents move away from cross-cradle as the babies get a little bit older and can get themselves positioned and latched sometimes. But going back to cross-cradle temporarily can help you, because in the cross-cradle position, your hand is supporting the back of the baby's neck, your fingertip and thumbs behind the baby's ears, and you can both prevent the baby from jerking the nipple, like, biting down and yanking, and you can also be able to apply the smoosh technique instantly. And the smoosh technique is one I'm going to teach you and we're going to talk about, because it's in my opinion, the most helpful technique for managing a biting situation. The smoosh technique, when you are using the cross-cradle position, means you use your hand. If the baby bites down, you use your hand to smoosh the baby's face very, very deeply and firmly into the breast tissue. It's not a punishment, and it's not hard and painful, but what really your goal here is to take your breast tissue, have it cover the baby's nose. So you're smushing the baby's face deeply into the breast tissue, and the baby's nose is covered and they cannot breathe, and so they will immediately open their mouth to breathe. And as soon as they open the mouth, they've released your nipple, and that's when you take them off the breast. If your baby bites down on the nipple and you try to pull their head away, you are going to get very, very hurt. You'll probably get cut and hurt. So instead, practice the smoosh technique. Think about this. Imagine doing it. Try it with a stuffed animal. Your baby bites down. Your instant response is to use your hand to smush the baby's face deeply toward your breast. Your baby will respond by opening his mouth, and that's when you take the baby off the breast. So you want to practice a controlled response without a shriek or a yelp, and we'll talk about that. Other preventative measures are when your baby is actively teething, offer cold foods and teethers before breastfeeding. Keep the breastfeeding sessions short, and are developmental, and I wouldn't want to see a baby medicated for teething day after day after day after day because they're fussy and irritable and they're not sleeping well at night. And if after 2 or 3 days you're not seeing a slit in the gum and the tooth erupting, I certainly wouldn't continue medicating for more than a day without talking to your pediatrician. Babies should not be on Tylenol or Motrin or Advil for teething for day after day. No way. Okay, so what happens though if the baby does bite down? Here's what you're going to do. Apply the smoosh technique right away. You just pull the baby's face deeply into the breast tissue and hold it there. As soon as the baby opens their mouth to breathe, get your finger right in there so they can't bite down again, and take the baby off the breast. Firmly say, no biting, with a still face. What's a still face? It means a flat, emotionless face. Still face. And you don't want to smile, you don't want to engage, but you also don't want to sound angry or yell. And this also may require practice, because for those of you whose babies don't have teeth yet or have never been bitten, I've had 2 children and I nursed both of them, and I don't remember it being an issue with my son, but my daughter, we've always had challenges. She's 18 now. We had challenges when I was pregnant with her because she was a 6-week premature baby, and we had challenges the first year and for the next 18 years. And sure enough, at 11 months, she bit me, and it hurt like the dickens, and I yelped, and she went on a nursing strike. And it was just, it was a mess, let me tell you. And I know better, but it hurt so much that was my response. I shrieked. Uh, okay, so you want to firmly say no biting. Keep a flat face. Do not smile. Don't engage. The hardest thing is when this biting turns into a game. Your baby thinks it's funny. Other people on Twitter were asking me, what do I do when my baby, comes in for a kiss and bites down, or the baby is patting my cheek or my husband's cheek and he hits instead of pats. A lot of times this is, if you permit this to continue, you promote the behavior. Or if you treat it playfully, it continues. So it's all about your response. Remember that your baby is not doing this to irritate you. They don't understand that they're hurting you when they bite, and they're not going to really learn empathy. Oh, that hurts me. Don't do that. I'm trying to feed you. Don't you want to eat? Just keep it simple. No biting. No biting. Be very serious and clear. Pretend, well, I'll get to that in the next slide. For a younger baby, I usually say 3 strikes, you're out. If they bite down, you try to, you work through that. You bring them back to the breast. They nurse for another minute or 2. They bite down again. If they're more focused on biting rather than nursing, just end that feeding. Move on, and maybe later they'll be hungrier and they'll not bite. And for an older baby, you can give them one try, and if they bite a second time, that feeding probably is over. And for an older baby, a baby that can sit independently, I would say maybe, a baby 10, 12, 14 months old, if they do bite down, I would take them off the breast, put them down on the floor if it's safe, if you're at home and you can do that. You say no biting, you put them down on the floor, get up and walk away. Their face will crumble. They will understand that something is amiss. Again, you're not punishing them, you're not yelling at them, and what you really don't want to do is startle them at the breast when they're nursing. Anger from your end is going to be a normal reaction because it hurts like the dickens, and your baby may think it's a game but is not being malicious. So I don't want to say your baby's not doing it on purpose, because they may bite down as a game, but they're not doing it knowing that they're hurting you. Okay, I put this on here. Do I have to say it? Don't bite back. I highly doubt anybody listening to my webinar would actually think that biting a baby back is a good response to being bitten. But let's just say that there are plenty of people in the United States who actually think that is an appropriate response when a child bites. And I will just reinforce the fact that it is not. Just another reminder what not to do when your baby bites. Do not engage or be playful. Do not show a harsh or an angry response. Don't startle or frighten your baby at the breast. Don't punish. You can correct them by saying no biting. Biting hurts, and then redirect them. Put them back to the breast, or give them a teether, end the feeding. Give them some solid foods. Go play, whatever. But you're not punishing them for doing this, because babies are 9 and 12 months old, which is kind of the target area that we're talking about here. They're too young to be punished. They don't understand the cause and effect of it. But don't allow yourself to get hurt over and over again. If your baby is in an acute nipping phase and they're biting and biting and biting during the feeding, don't keep putting them back to the breast and putting your nipple at risk. But don't just let it go. What you permit, you promote. So if you let your baby chew, bite you or hit you or throw blocks without intervening each and every time, it's going to take them a whole lot of time to learn not to do these things. But by not intervening, in a way, you are giving it approval. So don't just let it go each and every time. If your baby bites, you need to go through the whole thing. No biting. Biting hurts. Give them another try, end the feeding. And finally, I would say when a baby is biting at the breast a lot, don't give more bottles, because unless probably your goal is not inadvertently to wean, but if you begin to do less and less breastfeeding and more bottle feeding, ultimately that is what you are doing. So use an open cup or a sippy cup or a straw. Feed them more solid foods if you're concerned about the intake. Give them, what's nice for a teething baby is breast milk slush, semi-frozen breast milk that like Italian ice that you feed with a spoon if their gums are sore. But I wouldn't substitute a breastfeeding for a bottle feeding if your goal longer term is to breastfeed. A quick note that this is about table manners, this is about learning manners and what's appropriate behavior, and this is about safety. So just as you would not allow your 18-month-old to climb up on the kitchen table and stand there without intervening, you wouldn't let your child play with an electrical outlet or a cord like you see in the picture. You would intervene each and every time. You're not going to punish them, yell at them. You're going to teach them what's appropriate behavior, redirect them, and do it over and over again. Best yet, you're going to modify the environment so that these things happen less likely. So of course, you don't want a cord around where your baby plays all the time. If the cord interests him, of course he's going to keep picking it up and chewing it. He may know he's not supposed to, but he may not be able to resist that urge, because a 12-month-old baby may know a little bit, may sort of remember what they're not supposed to do, but that doesn't mean they can resist. And that's what we were talking about in terms of teaching them that, not giving them the thumbs up to bite any part of your body or another person's body. No biting other people, and by ending the feeding before, keep them actively feeding and then end the feeding before they just start hanging out, because that's when you're more likely to get bit. And teach your baby. I put this here from the toddler webinar, Nursing Your Toddler. Teach your baby appropriate ways to ask for milk. And these are just other good ways of teaching manners and table manners. Nursing at the breast in some ways is table manners. So just like, we think it's kind of funny, but it's really not. You don't want a toddler standing in the middle of Thanksgiving dinner yelling, "Nursey Ma!" No, teach them a code word. Maybe it's milk. Teach them sign. 10-month-olds certainly can sign milk, and teach them politeness. And your job as a parent is teaching safety, limits, manners, and not biting the breast and not biting other people is all of those things. If you do get a nip and it breaks the skin, you do have to be careful with that, because an area during the first week or two of breastfeeding, unfortunately. And a newborn's mouth has considerably less bacteria than a 10-month-old child's does. But you want to keep it clean. Just rinse the breast a couple of times a day. When you are in the shower, you can use soap and water. You want to watch for signs of infection locally, and you want to watch yourself for mastitis, which would be a sore breast, but also flu-like symptoms, a high fever, feeling nauseous and dizzy, chills at night, feeling like you've got the flu, but oh yeah, your breast is sore too. Because when you have an open area, an open cut on your nipple, it's a prime zone for infection to enter. A little bit of bacitracin, which is an antibiotic cream that's available over the counter. You could put that on 2 or 3 times a day after breastfeeding. In general, we recommend bacitracin all the time, not Neosporin. I always have this little saying in my head, no Neosporin. That helps you remember. Bacitracin, not Neosporin. No Neosporin, because Neosporin, many people are allergic to Neosporin and actually can cause skin irritation as an allergic reaction. So avoid the Neosporin, stick with bacitracin. I'm not advocating or suggesting that if you have a cut on your nipple, you use a nipple shield, but if it's going to be helpful, short-term use of a nipple shield in this situation is okay. And if you do get a cut on the nipple, there's a little 3-minute video on YouTube I did here that kind of guides you through some healing procedures. In the worst case scenario, nursing strike. And usually this is as the mother's reaction to being bitten. This is a whole other long topic I won't get into, but just remember, nursing strokes can take time to resolve. That's why I have the calendar here. If the baby isn't actively nursing, you do need to be actively pumping to keep your supply up and to have the milk available to feed your baby another way. The same things go with what I was saying earlier. I would not substitute breastfeeding for bottles. I would stick with open cup, straws, and solid foods while you're resolving the nursing strike. Nursing strikes are very upsetting for moms, and this is a link to the webinar right here that you can watch if you should need to. I probably spent half an hour trying to figure out how to embed the YouTube video into this webinar presentation unsuccessfully. So click either the picture or click the link later on. You must watch this if you haven't seen it. Probably 3/4 of Americans have seen it, but if you haven't seen it lately, you need to watch it again. It's a 1-minute video called Charlie Bit Me. I'm sorry that we can't watch it together, because I wanted to narrate and just say to you, like, look at this, look at the big boy, look at him sticking his finger in the baby's mouth and getting bit. What the hell do you expect? And then look at the baby's face after the baby bites, and it's hard not to get angry if you were the mom and that was your nipple with the baby, because the baby clearly looks mischievous and malicious, and like he's taking gleeful pleasure in causing that pain. And it's a little game going back and forth here, and I actually think it narrates the situation quite well. But I hope that we've reviewed some ideas as to how to prevent this from happening. I'll go back to that no, yes slide. I think that's really key. To not let your baby gnaw on any fleshy part of your body whatsoever. Give them plenty of teethers. Find the right kinds of teethers that fit nicely into little baby hands with a texture they like. Some of my favorites are the Winkle, the banana brush teether. I'll put these links in later on if you'd like, and Sophie the giraffe. I also like, for teething purposes, not for feeding purposes, something I call the food condom, but it's the teething feeder by Sassy. We have it here at ISIS as well. It's like a little mesh teether, and you could put an ice cube in there. You could put a frozen breast milk ice cube in there. You could put, if your baby's on solid foods, you could put a chunk of frozen cantaloupe in there, and let your baby kind of gnaw and slurp and bite and chew down. But this way you're teaching your baby over and over and over again. You can bite toys, you can bite teethers, you can bite fabric, you can bite your own fingers and feet if you want, but you can't bite other people. That's a good message to have. Okay, well, I spent some time on that topic, didn't I? Let's see what we've got. We've got a few questions, and I will answer them. Here's a random question from a mom who says, how does breast milk composition change over time? Specifically, I've been breastfeeding and pumping for my second daughter. She's 5 months. Initially, my morning milk was high volume, maybe 6 to 8 ounces, and thin without much fat, whereas the evening milk was lower volume with more fat. Now I feel like the volume doesn't change quite as much. Hold on, I lost the question. It's the problem. When the questions get long, I can't see the whole question. Wait a minute. Just trying to see if I can open it up a little bit. What does this mean, if anything, about the frequency of breastfeeding pumping in order to maintain milk supply? Do I need to keep pumping at the same time? Trying to see. Oh, this question goes on and on. I'm sorry, I can't read it all. But I'm not sure if you're asking about the frequency of pumping or the fat content. So one thing you noted, and you're correct, is that it's not that we have two kinds of milk, foremilk and hindmilk. It's that when there's a larger volume of milk that's sitting in the breast, the fat itself gets a little bit more diluted, whereas if you're expressing after breastfeeding, for example, you're going to express a smaller volume of milk, but the fat is going to be more concentrated as a ratio of the milk. But I really wouldn't worry too much about how thin or thick the milk appears and how thin or thick the ring of fat or the layer of fat is. As long as your baby is growing and gaining, we really can't control the fat content of our milk, and as long as you're taking in adequate calories and adequate hydration, your milk is going to have the right blend, the right balance of nutrients and fat for your baby. In terms of your baby being 5 months old, and you're talking about pumping 3 times during your workday, it looks like, or can you do fewer? Yeah, flexible. I can't see the full question, but I have multiple webinars on pumping when you're back at work? I would say in general for 5 to 6 months, most moms are going to need to time where things are most strained because babies usually haven't really started solid foods yet. They will soon, or even if they have started on the earlier side, they're still dabbling in solid foods and there's not a lot going in. So the baby still is kind of fully dependent on you for milk, and they're at their highest intake. So 3 times during the workday probably would still be needed, and sometimes moms will add a bedtime pumping session because often babies are going to sleep at 7 or 8 p.m. and mom is staying up till 10. So if you pump one more time before you go to sleep, that may allow you then to have enough milk for the next day at childcare. Now, if you are someone that is blessed with a larger storage capacity, if you truly can express the same volume of milk by pumping twice during the workday, then that could work for you. But I would say that in the majority of situations, it's not going to work out for most. So it's really dependent on the volume of milk. If you need to send 16 ounces of milk to childcare, if you can bring home 14 ounces, 13 or 14 ounces from work, and you get another 2 or 3 ounces at your bedtime, if you can get that same 13 or 14 ounces but pumping twice at work rather than 3 times, or if you've got lots of milk in your freezer from stockpiling before you went back to work and bringing home 12 ounces from work and another 3 ounces from the freezer works for you, you could do that as well. Okay, next question. Looking for some help. My 8-week-old doesn't like the bottle. She took a few, maybe 3 early on. Now 8 weeks won't take a bottle. Tried every night when she was half asleep and not too hungry. Also tried different bottles. 3 nights won't suck. Okay. Yes, I have. This is a little subspecialty of mine. I would say that, let's see if I can be fancy and change the slides. Bear with me for a minute. I'm still here. I just can't upload a new webinar and talk at the same time. My brain is just no longer able to multitask to that extent. Okay, I'm not going to do this whole webinar because I've done this whole webinar and it's recorded for you. And this is called Breastfeeding and Bottles Feed the Baby While Protecting the Breastfeeding. And here is the part in that webinar where we talk about the baby who will not take the bottle. And this is a large population that I work with because people come to me because their babies are not taking bottles. There are 2 types of bottle refusers. There's the active refuser or the adamant bottle refuser who turns beet red and screams when the bottle comes near. And then there's the passive refuser who will play and chew and let the milk drool around, but when push comes to shove, doesn't actually transfer milk from the bottle. In general, if you're a mom who has a young baby, I would recommend beginning to dabble with your breast pump around week 3, introduce the bottle around week 3 or 4, and then offer the bottle every other day. Once the bottle's going smoothly, which could be the first 3 days, once you've got the bottle feeding thing kind of figured out, continue to give a bottle every other day, even if it's just an ounce of milk, and then finishing the baby at the breast so that the baby remains familiar with the bottle. One of the bigger issues is what I call the bottle feeding vacation, where a baby has been taking a bottle and then goes for 5 or 8 days with no bottle. All bets are off. Bottle feeding is not something that you can do once or twice and then assume that the baby can take a bottle and always will. So some of the techniques that are demonstrated here are good for the 8-week-old baby that we're talking about. If evenings are the baby's fussy time and everybody else in the family is tired and cranky too, I would not work on it in the evening. Switch again into the morning when babies are typically happier. Some of these suggestions, like having the baby up against your chest facing out, like in the upper left corner. The baby is against dad's chest facing out into the room with the bottle coming in, and then dad should be moving, walking, bouncing. Movement and distraction can work well. The next picture on the upper right is what I call intermittent bottle by mom. I call that IBBM for short, intermittent bottle by mom. And that means you set up your bottle of 2 ounces of expressed milk right next to you when you sit down to breastfeed. Latch your baby on, let your baby nurse. After a couple of minutes of breastfeeding, interrupt the breastfeeding and offer the baby the bottle. If the baby refuses, don't push it, don't create stress, put the bottle down and put the baby back to the breast. And you just continue to intermittently offer the bottle while breastfeeding, and it's a way of saying the milk can come from here, from the breast, the milk can come from here, from the bottle. It's all milk, it's all good, it's all, and you're not reinforcing a negative experience by pushing or forcing the bottle on the baby. And if the baby refuses the bottle, no problem, you put them back to the breast. That's usually the most successful method. And if it doesn't work in the morning feeding, you put that same bottle of milk on the kitchen counter and use it again 2 or 3 hours later next time you breastfeed, or you put it in the fridge and rewarm it 3 or 4 hours later. You can work with that same bottle of milk 2 or 3 feedings in a row before finally discarding it, because it will be in and out of the baby's mouth and they'll suck a little bit and so on. But I would work on that several times a day, the intermittent bottle by mom several times a day for several days in a row, and usually that is the method that comes through. Other tips on the bottom here, you see on the bottom left, again, movement and distraction, and some good distractions are walking around outside, because outside is interesting. You could stand by a window if you have a window that overlooks a street and there's cars driving by. Face your baby out and try, offer the bottle that way. Sit on a physio ball and bounce gently while giving the baby a bottle. Stand in front of the television and try it that way. Movement and distraction usually work pretty well. Another technique is aim the bottle nipple toward the roof of the baby's mouth. Sudden suck harder, like they want to keep the nipple in their mouth. So if they have the bottle nipple in their mouth and they're sucking a little bit, and you withdraw the bottle, try to withdraw the bottle a little bit, sometimes they'll suck harder to pull it back in. And then, I go into some other things to think about and so on. But I refer you to this webinar, which is the breasts, bottles, and babies. Feed the baby, protect the breastfeeding. Okay, I think we need to wrap up because it is time. And thank you, Katie, for moderating today. And thanks everybody who came. Next week, I'm going to do all Q&A. So get your questions. You can come early and get your questions in, and we'll do 30 minutes of questions and answers. Next Tuesday, we'll be having our sleep webinar. That's every Tuesday at 12 noon. And next Thursday, we'll be back to 12 noon. Today was an anomaly, an exception that we had to do 1:30. What else can I tell you? I hope your babies don't bite. I hope that was helpful information for you. And everybody have a great week.